Hello, everyone. Today, we will be uncovering the 6 primary foods that can exacerbate arthritis on our channel. Additionally, our goal is to identify the underlying cause of pain and inflammation in your joints and provide the most effective solution to address it. Arthritis is a widespread medical condition characterized by inflammation, swelling, and stiffness in the joints. Among the various forms of arthritis, osteoarthritis and rheumatoid arthritis are the 2 primary types that are most prominent. The most common type of arthritis is osteoarthritis, which occurs as cartilage gradually breaks down due to wear and tear or injury. On the other hand, rheumatoid arthritis is distinguished by an autoimmune response leading to joint inflammation and potential effects on other organs within the body. Additional forms of arthritis include psoriatic arthritis, an autoimmune disease affecting people with psoriasis. A skin condition characterized by red patches covered with silvery scales. Gout, a painful condition, occurs due to the accumulation of uric acid in the joints, particularly affecting the big toe. Fibromyalgia is a chronic condition characterized by widespread muscle pain, fatigue, and joint tenderness. Although each form of arthritis has different symptoms and associated risk factors, one common factor among them all is that inflammation plays a significant role in their advancement. Let's start by exploring the main food that worsens joint pain, then investigate the real cause of inflammation and arthritis. 6. Oils and trans fats. Refined seed oils, also known as vegetable oils, are a major factor in worsening arthritis symptoms and inflammation. Frequently used oils like corn, sunflower, safflower, and soybean oils are commonly present in households and restaurants. Avoiding vegetable oils can be challenging because they are commonly found in a wide range of packaged or processed foods, similar to potato chips, hot dogs, white bread, fried chicken, French fries, and salty snacks. The primary concern with these oils is their high content of omega-6 fatty acids. These items are prone to oxidation when exposed to heat and light. When oil goes through chemical reactions, it undergoes oxidation, leading to rancidity. These rancid oils can trigger inflammation in your gut lining, joints, and blood vessels. The result is an exacerbation of chronic pain and disease. Artificial trans fats, often hidden under the name partially hydrogenated oils on food packaging, exacerbate the issue. Typical sources of trans fats consist of vegetable shortening in baked goods, microwave popcorn, margarine, fried fast foods, and non-dairy coffee creamers. Consider using healthier options to reduce inflammation, such as substituting vegetable oils with other alternatives, including avocado oil, macadamia oil, coconut oil, grass-fed butter, and extra virgin olive oil. Before we delve into the next detrimental food for arthritis, let's first grasp the underlying cause of joint pain. While you may have heard that inflammation is the primary cause, the truth is more intricate. The primary cause of all this is the excess fibrin around the joints, leading to ongoing inflammation and discomfort. This is how fibrin functions. Whenever your body experiences an injury, whether it's a minor bump, scratch, or a sudden change in temperature, it triggers a reaction. At first, white blood cells are dispatched to the affected area to combat infection, resulting in inflammation and swelling. Following that, fibrin is released to form a robust, net-like structure that seals the area and initiates the healing process. This network is crucial for capturing the platelets and red blood cells needed to create blood clots. Usually, once the wound has healed, fibrin breaks down and inflammation decreases. In cases of arthritis, fibrin continues to accumulate in the blood vessels and connective tissues around the joints. If there is an abundance of fibrin, it can thicken and harden, resulting in the creation of scar tissue that obstructs blood flow and limits oxygen delivery. Consequently, the healing process slows down, resulting in prolonged stiffness and discomfort. This is precisely why pain medications lose effectiveness over time. They fail to address the root cause of the issue. Fibrin affects more than just the joints. When there is an abundance of fibrin in your circulatory system, it hinders the delivery of red blood cells to crucial areas that require them. This causes your heart to work harder, resulting in elevated blood pressure. Increased levels of fibrin in the body increase the risk of heart disease and stroke. Before we disclose how to break down fibrin, let's explore other harmful foods that contribute to fibrin accumulation and inflammation. 5. Sugar and soda. Let's proceed to item number 5 and discuss the impact of soda and sugar on arthritis. Because of its high refined sugar content, soda has been associated with worsening osteoarthritis. Drinking soda leads to rapid spikes in blood sugar and insulin levels, leading to increased inflammation throughout the body. Moreover, beverages like sodas containing high fructose corn syrup contribute a significant amount of empty calories. These calories with little nutritional value contribute to weight gain, exacerbating arthritis symptoms. To decrease inflammation, it is advisable to replace sugary beverages with unsweetened tea or water. Making this simple change can reduce your intake of refined sugars and provide your body with a healthier alternative. 4. Refined carbohydrates. Let's move on to the fourth point. Refined carbohydrates. Have you ever noticed increased joint discomfort after consuming a large amount of pizza, bagels, cookies, donuts, or pasta? This occurs because refined carbohydrates in these foods rapidly transform into sugar, causing a surge in insulin levels. Consequently, systemic inflammation occurs, similar to the effects of consuming soda. For managing inflammation, consider replacing white bread and pasta with healthier options such as whole grain bread and sweet potatoes. Nevertheless, it might be beneficial to think about excluding gluten since it could potentially provoke inflammation in certain people. Now, let's delve into the third topic, gluten. For individuals with celiac disease or gluten sensitivity, the ingestion of gluten can trigger an immune response that leads to joint pain and associated symptoms. A study published in the Oxford Journal of Rheumatology found that 41% of people with rheumatoid arthritis observed symptom improvements by following a gluten-free diet. If you believe you may have gluten intolerance, it's recommended to eliminate all gluten-containing foods from your diet for a period of 2 weeks. During this time, make sure to closely monitor whether your joint pain gets better or worse. After the elimination phase, gradually reintroduce gluten and monitor your body's response. Gluten, a protein, is present in wheat, barley, and rye. By closely monitoring your body's reactions, you can determine if gluten exacerbates your joint pain. Now, let's move on to the second point, focusing on charbroiled and blackened dishes. If you have arthritis, it is advisable to steer clear of high-temperature cooking methods such as broiling, frying, and grilling. These cooking techniques produce advanced glycation end products that may increase inflammation and worsen joint pain. Avoiding foods like grilled meats and fried potatoes can help lower the intake of inflammatory compounds. Let's now explore our leading candidate, nightshade vegetables. People who have osteoarthritis, rheumatoid arthritis, or other joint issues such as gout might find benefits in excluding nightshade vegetables such as tomatoes, eggplant, potatoes, and peppers from their diet. Nightshades consist of alkaloids that may result in the accumulation of calcium deposits in tendons, ligaments, cartilage, and joints. This accumulation may lead to inflammation and discomfort. Let's delve into the underlying cause of arthritis, which is related to proteolytic enzymes. The main point is that proteolytic enzymes possess outstanding anti-inflammatory properties and play a vital role in enabling a pain-free life. These enzymes, known as proteases, are classified as systemic enzymes. They function by breaking proteins into smaller, easier-to-digest components, enabling the body to efficiently absorb them. One essential function of proteolytic enzymes is to break down excess fibrin located in the circulatory system and connective tissues like muscles. This step helps eliminate fibrin and scar tissue, improving oxygen levels and aiding in the delivery of nutrient-rich blood to the tissues. This method helps eliminate metabolic waste that leads to pain and inflammation. While the pancreas naturally generates proteolytic enzymes, their production notably declines after the age of 27. Therefore, it is essential to acquire proteolytic enzymes from dietary sources or supplements. Pineapple and papaya are excellent natural sources of these enzymes. Bromelain from pineapple and papain from papaya have been proven effective in alleviating pain, swelling, and joint stiffness in individuals suffering from arthritis. Additionally, kiwi fruit, figs, ginger, asparagus, and fermented foods such as sauerkraut, yogurt, kefir, and miso are rich in proteolytic enzymes. Besides their function in reducing inflammation and pain, proteolytic enzymes also serve crucial roles, such as reducing muscle soreness, accelerating wound healing, managing blood pressure, boosting the immune system, and combating viruses. To summarize, incorporating pineapple and papaya into your diet may be beneficial for reducing arthritis discomfort. However, it's important to recognize that relying only on food may not sufficiently increase your enzyme levels and alleviate the pain. Thank you for watching this video. Stay safe until we meet again. Goodbye.